Good evening. Welcome to 90 Days University Professional Free Final Mastery course of Oracle. Today we'll be learning about statistical tools and applications. Okay. In Oracle, you get 5 modes of learning that very important ways of learning. That is, we'll be covering rapid revision of all important questions, volatile facts, as well as high topics. And it is beneficial for all the students who are appearing for professional exams as well as and who are appearing from next exams also. Okay. Just, yeah. Today we'll be learning about statistical tools and their applications. What are the tools we learn about? Normal distribution curve and its relevance. What is hypothesis and how the hypothesis testing is done. Correlation coefficient and its importance in health data analysis. What is sampling and how the different types of samplings are done. And defining the confidence interval and its importance in public health. These are the 5 questions we'll be learning today. In Oracle, we'll have 5 modes of learning, that is recorded classes, live classes, practical sessions, exam modules, and hard copy book sets. In recorded classes, you will be having flexible way of learning where the information or the knowledge you get is from the expert educators, and you will be having convenient way of revision. You can learn wherever you are and wherever you go. It is like on the go types. Okay. In live classes, you will be given in-depth coverage of learning by the experienced educators, and you'll have interactive learning sessions also. In express module, you will be completing the whole syllabus in less than a day time, that is less than 24 hours, and you'll be giving answer writing skills, whether it be diagrams or flowcharts or how to write the answers in different methodology. It will be all by our expert examiners. You'll be having one-to-one doubts clearance also, so that you can clear your doubts before going to exam, whether it can be practical exams or theory exams or viva OC. You can ask any kind of doubt or any type of doubt without being getting judged. With all this, you'll be getting hard copy book sets also, where the last 10-year most commonly asked questions are covered in this, and you can read it whenever you're feeling bored screen or tired of looking at screens. And with this, you'll be getting a question bank, which is a 3-level question bank from beginner to expert level, and it is customized for professional exams, NEET PG exams, and as well as FMGE exams. Practical sessions, you'll be given hands-on experience, and you can face your viva and practical exams with complete confidence. You don't have to mumble or bumble during the exams, so that the questions are so asked, it is similar to the questions asked during the viva exams. For this, we have 4 types of subscription plans, that is 3 months foundation plan for 19,999 and advanced learning plan for 6 months at 32,999 and complete learning plan for 12 months at 59,999 and ultimate MBBS plan for 4 years at 1.9 lakhs. Do not worry, you have a very good discount code displayed below for the classes. With this, we'll be starting the statistical tools and explain the normal distribution curve and its relevance in biostatistics. Normal distribution curve, it is also called as bell curve. Okay. It is a fundamental concept of statistics. Why? We'll see later. It is a probability distribution that describes how the values of variable are described in a data set. This is the normal distribution curve. Okay. We'll see what is this and what is the percentages given here. Okay. When you say it is a normal curve, what are the characteristics of it? The characteristics are very simple. It is symmetrical in nature. Say it is very symmetrical in nature. Okay. The left half is the mirror of the right half. Mean, median, mode are at the center. It exactly in the center of the distribution. Whereas when you say your data is skewed towards right, okay, then your mode is somewhere away from the x-axis, that is the starting point. First comes the mean, followed by median and mode. Mode is the farthest one in the rightly skewed data. Okay, that is negatively skewed data. If it is positively skewed data, that means mean is on the right, farthest is the mean, and the nearest is the mode. Okay. What are the characteristics again? It is a bell shaped, the highest point at the mean. This is the mean. If it is normal distribution, then mean, median, mode are in the same place. Coming to the standard deviation. When you say that you are considering the data in one standard deviation, that is +1 to -1, that means you are getting only 68% of the data. This is the data which you are considering for your research. Okay. When you say that your data lies or the spread is around 95% or two standard deviations, that means you are considering this is the amount of data which you are considering. Okay. Sorry. This is the first standard deviation. Okay. This is the two standard deviation which you are getting. This includes that 95% of the data is there in the two standard deviation. For example, if you say that my data is mean of my data is x plus two standard deviation, that means you have considered the 95% of the data. When you say it is one standard deviation, you are considering only 60% of the data. If you say that three standard deviations, then you are considering 99% of the data, that is almost 100%. Okay. What is the relevance in this? Relevance is many things. When you take a huge population of 1 lakh and you take the height of all the people of all the age groups and plot a graph, most of the times it will be a normal curve. Okay. In a study of height, most people are close to the average height. Very few might be on the right side and the left side who are very tall and who are very short. Okay. That is hardly 5%. This helps in setting the normal ranges. For example, when you say that blood sugar is normal range of blood sugar is less than 100. This means this has been calculated based on the average that 95% of the adults, when you take the blood sample in a normal non-diabetic patient, non-diabetic individuals, their blood samples are coming in the normal range. The 5% might come in the abnormal range also, but majority of the times it comes in the normal range. So when you want to decide that a normal blood sugar or a diabetic range, you want to do something, you can't say that person who is having 200 also diabetic, you can't say a person who is having 140 also diabetic. So you need to fix a range. That range can be fixed by normal curve. It helps in making predictions, comparing two groups, and helps in analyzing the data. Okay. For example, okay, a lab measuring fasting blood glucose in population of healthy adults to determine normal range. What does the lab do? It connects 1000 samples. Okay. Then calculate the mean. It comes in 90. And in standard deviation is around 10 milligrams per deciliter. That is 80 to 100. In a normal distribution, if you are saying that one standard deviation, that means it varies from 80 to 100. In 95%, in second to standard deviation, it varies from 70 to 110. Why is this? When you say that considering the 95% of the population, 70 to 110, anything above this, it is abnormal. Anything below this is also abnormal. Either it is hypoglycemia or it is prediabetes. Okay. This range has to be specified for the sake of what? To make the diagnosis. Anywhere outside this normal range is called, can be diagnosed as some disease or some abnormality. Okay. Next we have, what is hypothesis? In statistical research, explain the steps of hypothesis testing. Hypothesis is a statement which you assume about a population parameter or a relationship between the variables that can be tested through statistical methods. When do we assume this? You assume this at the starting point of the investigation. First step is define the hypothesis. We'll come to an example later. When you say define the hypothesis, you will have two hypotheses, that is null hypothesis and as well as alternative hypothesis. Null hypothesis means that is no difference between anything, or there is no effect of A on B or B on C. Or if you're consuming a drug and if you say null hypothesis, the drug A which you're consuming does not have any effect on your body. When you say it is alternative hypothesis, it is having some effect. It could be positive effect or negative effect. Then you have to set the significant level, that is threshold level, because you have to set the errors also. You can't say that all these errors are mine. Okay. Decide the threshold level, often set at 0.05%. If the p-value is less than alpha, that is less than 0.05, the null hypothesis is rejected. Please do understand, you don't accept the hypothesis here. You reject the null hypothesis. You don't talk about the alternate hypothesis. Okay, the moment you say the null hypothesis is rejected, that means alternative hypothesis is accepted by default. Then you collect the data, measure the blood groups, then select the statistical test which is required. It could be a t-square comparing means, chi-square if for the categorical data, and ANOVA if you are doing the measures multiple times. If you are taking blood pressure, you are taking a blood pressure reading now on day 1, then you give the drug tomorrow, then you take the blood pressure day after, again take the blood pressure after 3 days, again blood pressure after 5 days. If you want to calculate or test the multiple readings of day 1, 2, 3, 4, then you will apply ANOVA. It is called as analysis of variance. Calculate the test statistic p-value, use the data compute to test statistic, then you will get the p-value. Then you make a decision. Okay, compare the p-value. If the p-value is less than 0.05, which you have considered over there, then you reject the null hypothesis. Okay, that means the evidence which is there, it is supporting the alternative hypothesis. Okay, if you fail to reject the null hypothesis, that means there is no sufficient data to support the alternative hypothesis. Okay, for example, there's a new medication which has come into the market to reduce cholesterols. The null hypothesis would be no medication does not have any effect, and medication reduces cholesterol is the alternative hypothesis. You have taken significance of 0.05, that is 5%. Collect the data, use the t-test to compare between two groups, average of cholesterol levels. If the value is less than is 0.02, that means you are rejecting the null hypothesis, that is less than 0.05. Here you are rejecting this, that medication has no effect. This you are rejecting, that means you are indirectly accepting this. Okay, conclusion, the medication significantly reduces cholesterol levels. This is how the hypothesis testing is done. The next question what we have is, describe the correlation coefficient and its importance in health data analysis. The correlation coefficient is denoted as R in the while writing. It is a statistical measure that indicates the strength and direction of a relationship between two variables. It ranges from -1 to +1. Okay. If R is equal to +1, that means there is a perfect positive correlation as no variable increases. Okay. As one variable increases, the other one also increases proportionally. A is increasing, B is also increasing. If you say R is -1, that means one increases, the other has to decrease. If there is 0, that means there is no correlation between or relationship between the variables. There are two types of correlations. That is, Pearson correlations measures linear relationship between variables, and Spearman rank correlations measures monotonic relationship between. That means non-linear correlations. We'll see later how it works. How do we apply this correlation in health data? It helps in identifying the risk factors. How? It helps the researchers to identify the potential link. That means if you say that there is a positive correlation between smoking and lung cancer, the consumption of the number of cigarettes smoked is directly related to the risk of lung cancer. When you say consumption of alcohol can cause gastritis, the amount of alcohol consumed is directly proportional to the number of cases of gastritis. Number of people are increasing, the cases of gastritis are also increasing. Effectiveness. Investigating whether increased physical activity correlates with blood pressure. Increase the physical activity, there might be reduction in the lower blood pressure, reduction in the blood pressure. Okay. You might give some drug, then check the blood pressure. Give the drug, then check the blood glucose. And it also helps in predictive modeling. Okay, like strong negative correlation between exercise frequency and diabetes risk. This is one of the examples which can be used in predictive modeling. Next, we have clinical decision support. A strong positive correlation between high cholesterol and high heart disease can guide treatment decisions. Okay. Public health studies studying the correlation between air quality index and asthma hospitalization rates. This is the, if the air quality index is high or if it is low, then you can go for the number of cases you can correlate with the number of hospital admissions for this asthma cases. Okay, limitations. It uh, it measures only linear relationships. That means 1-to-1. If weather is bad, the cases of URTA increases. Okay, it does not take the confounding variables. Okay, and other factors which might influence, even that is also not considered in the correlations. Okay, next we have sampling. Explain the different types of sampling methods used in public health. What is sampling? Sampling is a process of selecting a subset. You have 100 people, take a sample of 10. If you are taking 10 people out of 100, that means that 10 is a sample. Okay, we have many types of sampling. We'll see in by one. Before that, importance of sampling. Why? If you want to study 1 lakh people, it is not possible. It is very difficult to study 1 lakh people for a particular disease. So what you take is a sample. You select 100. That is sampling. You can do a test, or you can do the intervention on 100 and extrapolate it to the 1,000 people or a lakh people. That is cost effective. Getting the test done for 1 lakh people is very difficult. So you do it on a smaller group of people. Time saving. Feasibility. Easy to manage data and easy to manage the workforce, manpower, money, material, etc. Okay. Accuracy. If the test or the sampling is done correctly, you can have a very good representative insights or the results. There are two types of sampling in public health. That is probability sampling methods and non-probability sampling methods. We'll see one by one. Probability sampling ensures that every individual in the population has an equal chance of being a part of the study. Okay. In this, we have certain types. That is simple random sampling. Okay. You have group of 12 people, 16 people. You are asked to select 4. You go and pick the 4 without thinking anything. You just pick the 4. Okay. Example, randomly selecting 200 people. You make a list of you have a list of 1 lakh people. Take 200 very randomly. That is a simple random sampling. Next, we have systematic random sampling. How do we do this? List out the individuals and you say nth number I will take as a sample. That is every third person I'll take a sample. Here it is, example is every fourth participant is selected. Okay. Every fourth person is who is visiting the hospital, I will take them as a sample. Okay. This is a systematic random sampling. You are using some system here. Again, stratified sampling. Okay. First, you take the group of people, you divide them into different groups based on particular, you can ask occupation, you can take gender, you can take age group of 1 to 10, 10 to 20, 20 to 30. Then you take a sample from that group. You can take again simple out of simple random sampling out of that, or you can take a nth number also, that is stratified sampling. It becomes stratified sampling at that time. Okay. Here, if you are taking first two, this is the stratum, this is the stratums which are formed, and out of it you are taking the sample. Okay. Cluster sampling. What does cluster sampling mean? The population is divided into groups first. Okay. It is based on the villages, schools, etc. Then out of the clusters, you randomly choose those clusters. Okay. This is the randomly chosen clusters. Once they are randomly chosen, they become the sample. You have a group of people, you divide them into clusters based on the common criteria of people or the subjects. Then you take a sample of clusters, not the subjects, the whole group. Now we're coming to the non-probability sampling. Non-probability sampling is, in this you don't give an equal chance of the people to get selected in the study. Okay. You just go into the field and or the hospital, you say that who are the first five people I'm seeing, they'll take them as a sample. Okay. Next is, this is called convenient sampling. The next is purposive sampling. Participations are deliberately chosen here on a specific criteria. Okay. You can, like, you are selecting group of children of Down syndrome only. That is purposive sampling based on particular judgment. Okay. Or you are taking a sample of individuals suffering from Duchenne muscular disorder or dystrophy. You are taking only them for the study. That is a purposive sampling. Next, we have snowball sampling. It is very simple. It will be most commonly asked in your Viva OCs, and so you will get confused. It is very simple. You have a subject, you select a person as a subject, and that person will get others as a subjects for the study. That is called as snowball sampling. Okay. You have a person who is involved in substance abuse, and you will catch hold of other 10 people who are involved in substance abuse, and you will get them for your study. That is called snowball sampling. Quota sampling. In this, researchers set quotas of different subgroups, then select participants. There you selected the whole cluster. But here you will ensure the groups, then you select from that quotas. Okay. Choosing the right sample is the most important thing. The most important objective should be the study. Okay. Because the sample which is representative in nature gives you very good insights. And since the manpower, time, and budgets are limited, it is always useful to get a good sample. Okay. We'll go to the next question now. That is the last question for today. Define confidence interval and its importance in public health statistics. Confidence interval is a range that tells how sure we are about that result, what we are getting. Okay. It shows where the true value of the entire population is likely to fall. Example, if a survey says that average height of adults in a city is 20 plus or minus 2 centimeters, the confidence interval is ranging from 18 to 22 centimeters. Okay. The average is 20 centimeters. Standard deviation is 2. So hence the confidence interval is 18 to 22. Okay. What does simple words mean. For 95% confidence interval, if we repeat the survey of the average height, and take the average of the height of the adults in a city, true value would fall 95 times out of 100 in this range only. Okay, that is what the simple meaning is. If you do 100 times, then 95 times it means the value of the height falls in this range only, not anywhere outside. 5 times it can fall outside, but 95 times it falls in this range only. That is what the confidence interval means. It is as simple as that. It helps in quantifying uncertainties, okay, and it helps in supporting decision making also. It helps in comparing groups. Confidence allows comparison between populations and interventions. You are doing a study on 2 different cities, then it allows you to help, it allows you to make decisions without any overlaps. Okay, when you compare the obesity in 2 cities, in city A it is 30%, at 95% confidence it is 25 to 35%. In city B it is 40% at the range of 38 to 42%. The confidence interval varies for both the cities. Okay, and you can test the difference between these two if it is significant or not. It helps in interpreting study results and generalizing the results for the whole population. Just a minute, there is a problem with. Yeah, now it is clear, right? How does it help in interpreting the study results? It helps the, for example, in a smoking cessation program, 60% participant quit. Okay, there is an estimation program in this, and wide intervals suggest more variability. If you say that, see, there is only, but there is almost a difference of, sorry, this is the difference, 20 to 80%. That means here the variation is very high, here the variation is very less. This how you can generalize the results also. Confidence intervals are critical tools. If you calculate the p-value between the two confidence intervals, if it is significant, it can be generalized to the whole population. Okay, with this we'll come for our MCQs today. The total area under a normal distribution curve is, it is always 1. Okay, 100% is always 1. Which of the following is a null hypothesis statement? The mean blood pressure of group A is higher than group B. There is no difference in the means of group A and group B. Group A has lower average weight than group B. Treatment A is more effective. Treatment B. What does the null hypothesis say? That means there is no difference in means or anything. There is no difference or no significance, no involvement of anything. So the answer is B. The correlation coefficient ranges from, between, it is -1 to +1 only. Okay. If it is +1, it is positive correlation. If it is -1, it is negative correlation. Okay. The process of selecting subset of a population for a study is known as, you are selecting a subset of a population. It is called as sampling. In a 95% confidence interval, the remaining 5% represents what? Margin of, it is a level of significance. In 95% confidence interval, the remaining 5% is significant. Okay. A positively skewed distribution has, what comes the first? First comes the mean, median, and mode. Mean is greater than, what you say? The graph is like this. First comes the mean, then comes the median, last comes the mode. Sorry, this is the negatively skewed data. This is positively skewed data. The first one is, here comes the mode, median and mean. The mean is higher, median is still lower, and is less than, still greater than mode. Okay. This is negatively skewed data. This is positively skewed data. The p-value in hypothesis testing indicates the probability of accepting the null hypothesis, strength of evidence of null hypothesis, degree of freedom, variability in the data set. Now you get confusion between A and B. These two are not. Okay. It is the strength. You are checking the effectiveness of the strength. It is not, you're not checking how many times the you can accept the null hypothesis. You are thinking that how strong I am in accepting this or rejecting this null hypothesis. That is what p-value is all about. The method of dividing a population into subgroups for a sampling is called stratified sampling. You divide them into stratum and you get the sample out of them. The width of confidence interval decreases when sample size increases, confidence level increases, variability increases, or data skewness increases. It is when sample size increases. A scatter plot is primarily used to show frequency distribution, compare proportions, identify relationship between two variables, summarize categorical data. It is identify relationships. You can't show the frequency distribution. You can use histograms. Compare proportions. Again, you can use histograms. Categorical data, you can't use scatter plot in this. So it is only identifying the relationship between two variables. Okay. With this, we'll be completing our class today. We have social media handles for Auricle on YouTube, Facebook, Instagram, and Telegram. And there is an app available on Google Play for Android users and on App Store for iOS users. Thanks for watching. See you in the next class.
Hello, sir. Hello.
Hi. Hi, Sandeep.
Hello, sir.
Yes.
Sir, Dr. Suresh want to have some doubts, sir.
Yeah. We'll take it.
Hello, Dr. Suresh.
Yeah. I'll close
Hello.
it. Hi, Dr. Suresh.
Sir, good evening, sir.
Good evening, Suresh. How are you?
I'm fine, sir.
Yes, go on.
Sir, web of cessation, sir.
Regarding
Web of cessation.
web of causation, right?
Sir. Yes, sir.
The web of causation is like you take a spider web. Okay.
What, sir?
You have seen a spider web.
Yes, sir.
See, in the center of the web, there is something called, there is a spider.
Okay.
You consider that spider as a hypertension. Okay.
Okay, sir.
There are joints in the spider web. There are joints, like circle is formed and inner circle is formed. Again, there is a vertical lines which are being connected to each other.
Yes,
There are
sir.
joints, right? You consider those
Yes, sir.
joints. One as decreased physical activity. Take one more point as improper diet, or what you say, unhealthy diet. Okay.
Okay, sir.
Take one more
Okay,
joint
sir.
as age, gender.
Okay.
When you connect all these, you get the hypertension.
Okay, okay, sir.
This is what is web of causation. You can apply this to any concept which you can apply. You can apply it to diabetes also. You can apply it to cancers also, if it is a causing because of the radiations, multiple exposures of radiations. Okay.
Okay,
This
sir.
is what
I
is web of
understand, sir.
causation.
Sir,
Yes, go on.
sir,
Hmm.
then
I'm listening.
many recorded videos for PSM not coming, sir.
Suresh, Dr.
Sir.
Suresh, that videos are getting uploaded on daily basis. Don't worry. In a day or two, within maximum 74 hours to 4 days, you'll be getting all the videos.
Okay, sir. Okay,
Okay.
sir.
It is getting
Give,
uploaded on the
give
app.
ad.
Okay.
Yeah, sir.
Yes, go on.
They give ad on September, sir, for third year.
Okay.